Good afternoon, everybody. Hi, my name is Deb Gavin, and I'm the Director of the Australian College of Applied Psychology Clinic. And I am here today with two of our provisional psychologists. We have Kristen Grisdale and Jennifer Pluth. And we're here to speak with you today about mental health in recognition of World Mental Health Day, which is coming up on Sunday. So I just wanted to begin with acknowledging the traditional owners of the lands on which we're meeting today. The ACAP Clinic is located all over Australia, so sits on traditional lands in many places. But in Sydney, it sits on the land of the Gadigal people of the Eora Nation. And I would really like to pay my respects to elders past, present and emerging, and also pay my respects to all Aboriginal and Torres Strait Islander and other Indigenous peoples who are visiting with us today. So we'll just begin by giving you a bit of an outline about the clinic and then introduce our speakers. And just ask if you have any questions or comments, please feel free to pop them into the chat function, and then we'll address those towards the end. And I'll actually speak about the clinic a bit later on, actually. So we're just recognizing that people are in lockdown all over the place and dealing with issues related to COVID in particular. And it has been an extremely stressful 2020 and 2021. And so for this World Mental Health Day, we really wanted to share with you some of our experiences and learning around social anxiety in particular, and also mindfulness. So our provisional psychologists are going to speak about those issues in particular, and hopefully you'll be able to get some really great tips and learn more strategies and skills to build for your toolkit around those particular issues. So first, I'll introduce Kristen.
Thanks so much, Deb. Okay, so before I begin, I would like to also acknowledge the traditional owners of the land on which our college teaches. I'm standing on the lands of the Guringai people, and I wish to acknowledge them as traditional owners. I would also like to pay respects to their elders, both past and present, and extend that respect to other Aboriginal and Torres Strait Islander people present today. Did you want me to continue on, Deb, or did you want to jump in before I?
Well, I think if you could please continue on, and then we'll jump across to Jen.
Okay, beautiful. All right, can do. So as Deb said, my name's Kristen Grisdale, and I'm one of the provisional psychologists completing professional training at the at ACAP. So I'm doing clinical psychology there. And today I'm going to talk to you about social anxiety, specifically what it is, and why it is especially timely to discuss how it can affect us given where we are at in our lockdown journey. I'd then like to take the opportunity to share some tips with you on managing feelings of social anxiety, as many of us do start to come out of lockdown. So firstly, what is social anxiety? So I'm going to borrow a little bit from Gillian Butler, who's a clinical psychologist and author. Put simply, it describes the fear, nervousness and apprehension that people experience in their relationships with other people. People with social anxiety often fear that they might act in a way that's humiliating or embarrassing, or that by interacting, they will reveal weaknesses or awkwardness. Some signs and symptoms that are common are thoughts such as worrying about what people might think of you, focusing attention in on yourself, dwelling on things that you did wrong. Also behaviours such as avoiding anxiety-provoking situations, and also physical symptoms as well, like blushing or feeling tense and your heart racing. Everyone feels socially anxious at times, but unfortunately some people are more vulnerable than other people, and therefore experience it more consistently and more intensely and for longer periods. So I mentioned that I would talk about why it is timely to discuss, given that for some parts in Australia, the exit for lockdown is near. What we know about managing social anxiety is that it can be alleviated by constantly putting ourselves in situations that make us anxious, which over time become less and less scary. So probably everyone can relate to starting a new job or starting at a new school. And on the first day, you're thinking things like, what if I don't fit in? And they're going to realize I have no idea what I'm doing. And so you wake up at 5 a.m. and you work really hard and you make sure that you're not late. But then over time, let's say on your 100th day of your job, you're lucky if you even squeeze a shower in or remember some deodorant. So we just know that over time, if we confront things that scare us enough times, eventually that thing just won't be so scary anymore. So what does that mean then for those of us that have been locked in for such a long period of time without much opportunity for social interaction? Well, for people that have social anxiety, perhaps the thought of working or studying or doing what you want to do at home was at first a little bit relieving. But now, given the absence of the opportunity to consistently confront things that make us anxious, and therefore no opportunity to reduce the anxiety over time, the thought of getting out there again may be a daunting one. And as I mentioned earlier, most people experience social anxiety at times. So while some people may not consider social anxiety to be a problem for them, given our circumstances, it wouldn't be overly surprising if these people also start to notice some social anxiety as well. So I promised you some tips. So here they are. My number one is to practice self-compassion. So self-compassion is about being aware of our own struggle and pain and recognizing that it is a normal human experience and not a personal failing. So this is an important one, as people might be noticing other people and companies, influencers, being excited and perhaps sharing or encouraging grand plans of partying on boats, having big family gatherings, visiting theme parks for Halloween, which is scary enough. It can be hard not to think that this is what everyone is doing and that you're the odd one out. But it's extremely likely that you are not. It's just perhaps that these people are less likely to talk about their experiences on the internet. So know that you're not alone. Self-compassion is also about treating yourself with kindness and caring for yourself, like you would for someone else who's struggling. A nice way to implement this is to conjure up an image of a supportive person in your life. What would they say to you right now if you're feeling anxious? Maybe they'd say something like, that sounds really hard, or I'm sorry that you're experiencing this. Self-compassion also requires taking a balanced approach to our negative emotions so that feelings are neither suppressed nor exaggerated. Mindfulness is a really good way to go about it. It's a non-judgmental, receptive mind state in which one observes thoughts and feelings as they are without trying to suppress them or deny them. And my friend and colleague Jen will talk about that shortly. So my second tip is for when we're in the thick of those situations that make us socially anxious. A really common tendency for people with social anxiety is to focus their attention inward. For instance, they might think things like, people can notice that I'm blushing, or I look so awkward right now, and I'll never recover from this. What happens here is that we become painfully aware of what's happening to us, and this makes us more self-conscious. So what we can do here is practice shifting our attention from inward to outward. And by learning to do this, we can pick up cues in the situations that might disconfirm some of the thoughts that we're having about ourselves. So this is something that we can practice even before we get out there again. We can even do it now together. You have a think about some of the physical sensations that you have right now. Are you hot? Are you cold? Are you tired? Are you hungry? Do you feel like your jeans are too tight? Okay, now we can have a go at shifting our attention outwards. So is it noisy where you are? What's the weather like outside? What do I think of the speakers' outfits here? So this is something that we can sort of keep practicing, and over time we'll become better at it. But the thing about attention is that we can only really focus on one thing at a time. So for example, when you're engrossed in watching TV or reading a book, it's hard to focus on your partner who's nagging you to do the dishes. So it does come with some perks, and we can use this to our advantage to help with feeling anxious by turning off our inward attention and turning on our outward attention. My third tip is to go at your own pace. I mentioned earlier that it may seem like everyone is getting out there to the extreme, but that shouldn't make you feel pressured to jump in the deep end. You may also notice all your friends and family trying to arrange catch-ups, but it's also important to remember your boundaries. Ease yourself into it and perhaps catch up with your nearest and dearest who you feel comfortable with and who you can trust before planning a holiday with 20 of your acquaintances. In all seriousness though, ease into it. Don't cave to feelings of pressure and move at your own pace. Finally, I'd just like to recommend that for anyone struggling with this or find that attempts to assimilate are harder than expected, you can reach out for professional help. ACAP runs a fantastic social anxiety group, which runs for 8 weeks. So you can give the ACAP clinic a call if you feel like that might be a good fit for you. And we'll pop in the details for that shortly in the chat. I'd also just like to say, if I brought up anything that might be distressing to anyone, Lifeline is a 24-hour service and the number is 13 11 14. So thanks so much, everyone, for listening to me. I'd like to hand the reins over now.
Thanks, Kristen. That was really helpful. I think there were a bunch of great strategies there, and also the explanation of social anxiety and the way that you linked it to our physiological indicators was really helpful. I think that people will no doubt have found that really useful. So thank you very much.
Thanks, Deb.
Now I'd like to introduce Jennifer Pluth, who is another one of our provisional psychologists, and she'll be speaking with us about mindfulness.
Awesome. Thanks so much, Deb and Kristen. So as Deb mentioned, my name is Jen, and before I begin, I'd like to acknowledge that this meeting is being held on the traditional land of the Gadigal people of the Eora Nation, and pay my respect to elders both past, present, and future. So as I mentioned, I'm a provisional psychologist at ACAP, and today I'll be outlining some tips on how to use mindfulness to make your day more productive. So before we begin, what is mindfulness? As John Kabat-Zinn states, mindfulness means paying attention in a particular way on purpose, in the present moment, and non-judgmentally. So research demonstrates that mindfulness practices can contribute to well-being at work and lead to happier, healthier, and more productivity. So in particular, mindfulness helps with nervous system regulation. So it helps to move from the fight, flight, or freeze into rest and connect, which has the flow-on effect of lowering our blood pressure, regulating heart rate, regulating noradrenaline, and aids digestion. So we know that studying mindfulness creates some distance between you and your negative thoughts and feelings, and that these short-term physiological effects combined with cognitive distancing can help us deal better with stress and distress in our lives. So without further ado, here are some tips on how to use mindfulness to make your day more productive, in particular for those working from home. So number one, we want to be able to define your workspace. This means confining your workspace to a specific area in your home so your productivity doesn't intrude into the lives of other household members and you can concentrate. So having this space that you designate as your workstation, instead of checking emails, voicemails, or texting in front of TV, or spreading work out on the kitchen table, if you don't have a separate room, find an area with minimal traffic flow or a corner of a room off from the main area. We want to be able to establish a defined schedule and stick to it. We want to treat this workspace as if it's your office across town, even though you might be walking into the next room or so. So only go to this designated space when you need to complete a task and trying to maintain the same hours you log at the office, so you're not consumed by the workload. We want to be able to pace ourselves. So making that conscious effort to toil in the present moment as much as possible, such as being mindful of your virtual co-workers and consider eating and walking slower. So one of my favorite mindfulness practices is mindful eating, which involves bringing our attention to the entire experience of eating. For example, eating a chocolate block. In mindful eating, we focus our attention on the chocolate with an open mind and gentle curiosity. What color is it? What does it smell like? What are the textures on the chocolate like? So making these observations to focus our attention on food and experience of eating. Another tip is practicing self-care. It's important we balance our days with nutritious food, regular exercise, and ample sleep. Stuck at home, it's possible to work 24/7, but that goes against healthy self-care. So we want to tell ourselves there's a limit to what we can do and put the rest out of the picture. If you feel guilty not working, remember that putting on the brakes of rest and relaxation gives you the fuel to accomplish your goals. We want to be able to set boundaries. So being able to say no and refuse to commit to more projects when you're already overloaded. Telling yourself there's a limit to what you can do. When you say yes but mean no, you're not taking good care of your mental well-being. Similar to what Kristen mentioned, being able to develop self-compassion is important in mindfulness practice. So being able to pay attention to how you talk to yourself rather than attacking yourself when you forget, make a mistake, or fail a task, allowing yourself to experience compassion. So practicing kind-hearted words, the same nurturing support and loving kindness you would give to your best friend. Want to also be able to block time for relationships. So it's important to integrate more time in your productive schedule for interactions with virtual coworkers and friends and family members. Take those days off where you unwind and have fun. So integrating that personal time in your day as often as you integrate tasks into your personal time. As Kristen similarly mentioned, so at the ACAP Psychology Clinic, we are running another mindfulness-based skills group. So if you are interested in learning more about these mindfulness-based skills and meditation practice in a practical and applicable way, as well as improve coping skills for difficult emotions and distressing thoughts, feelings, and sensations, then feel free to contact us. I will pass now to Deb.
Thank you so much, Jen. And again, that was a really helpful session that you outlined there. And, you know, some different strategies. So noting that mindfulness practice can help with generalized anxiety. And I guess, you know, there's strategies that we can use in all areas of our life. And social anxieties is something that we're definitely feeling coming out of lockdown as well. And given that we're likely to be living in a bit of a hybrid environment where we might continue to work from home or go into the office or workplace, you know, as needed as well, it's really great to hear those strategies around boundaries, and I found that particularly useful as I sit here at the kitchen table. You know, I was reflecting on all of those. So we're just addressing any questions that people have had through the sessions. And again, if you do have a question or comment, please feel free to pop it in the chat. But we do have a question from Charlotte. So Charlotte has asked, do you have any apps or resources you would recommend to help with personal anxiety? So that's a great question, Charlotte. I might just spend a minute answering that and then open the space for Kristen and Jen to jump in if you have some additional tips as well. There are definitely a huge number of apps and e-resources that are becoming available. And in fact, that's one of the projects that we're looking at the moment with our student social workers and counsellors who also work in the ACAP clinic. We're looking at e-therapy and how we can incorporate some of those resources into our practice. But at the moment, what I would suggest is that there are some really quite well-resourced e-therapy resources, particularly MindSpot would be one that I would recommend. So MindSpot is an initiative that has been started by Macquarie University in Sydney, and they offer a really broad range of resources. They have online e-therapy programs that you can access from anywhere. And they also have clinicians who sit behind the scenes and can direct the response that's provided to their clients, you know, and also reach out and make contact with clients using their e-therapy resources. But MindSpot is a terrific resource and highly recommended. But there are many others as well. If you look at the Black Dog Institute or Beyond Blue, you'll also find some other online resources and apps, because apps are a great way to be able to track your mood and just get access to little bits of little tips and tricks, and remind us as well, even just from our Fitbit. Not that I have a Fitbit, but I've seen others and it buzzes to tell them to get up and remember to walk around, which relates back to what Jen was saying. Kristen and Jen, do you have any others that are your favourites?
Yeah, I've got a couple. As Deb and Jen both mentioned, mindfulness can be really helpful in alleviating anxiety. So I've got a couple that I like to use and recommend. Breathe and Smiling Mind. They're both good mindfulness apps that can certainly, evidence-based to help with anxiety. So that's my tip.
Yeah, that's really great resources as mentioned. And also another kind of mindfulness app that can help too is called Calm. So that's available in the App Store. And there's also a website called the Clinical Center of Clinical Intervention. So it provides kind of self-help resources on anxiety as well. So check that website out, CCI.
Yeah, thank you. I have been meaning to check out Calm, so I'll have a look at that. In terms of mindfulness ones, I use Insight, which is another app that's really good for meditation and has a whole range of guided meditations, which I find quite useful. There's another question here. This one is from Marie. So Marie has said, "Good day, everyone. My question is, does exposure therapy work with socially anxious clients? If yes, when is it okay to start this type of therapy? Thank you." Would one of you guys like to jump in relation to that one first up, or otherwise, exposure therapy isn't a practice, and jump in to correct me. But as I understand it, in terms of what you guys are offering, exposure therapy isn't something that you isn't a model of practice that you're currently using. Is that right? Your approach is much more CBT based or cognitive behavioral therapy based?
Yeah, we can actually sort of use exposure therapy within the broader CBT framework. Mm-hmm. So it is actually super helpful for social anxiety. It is one of sort of the I guess go-to therapies for social anxiety. And as I was sort of mentioning when I was talking before, getting out there again, not having that opportunity, that's sort of a maintaining factor of social anxiety. So naturally just getting out there every day is almost like exposure therapy. But certainly effective. And it is something that we do build into the group therapy, and it's shown to be quite effective. In terms of when to start it, I suppose when you feel ready. But yeah, if you connect with a clinician, you can start to have those conversations about whether, collaboratively you think that that's a good fit for you. But yeah, good question.
Thanks, Kristen. And when you were talking before about building up our tolerance for social activities, and not just, sort of coming immediately out of lockdown and inviting 20 people to a really formal event or something, is that almost a process of exposure by building up, building up our social engagements?
Yeah, certainly. So there's some different methods for exposure therapy, and the most common by far is gradual exposure therapy. Where we typically start with things that, as one of our lecturers says, that make us comfortably uncomfortable. So just pushing ourselves a little bit, and then sort of moving up a hierarchy in terms of things that make us socially anxious. The other approach is something that we call flooding, which is where we do just jump in the deep end. And for a lot of people, that's, pretty scary. So the gradual exposure approach is probably more favored.
Thank you. There's another question. This one is from Nina and it relates to telehealth. So the question is telehealth a good option? How do I find and choose the right therapist for me? So I would say, Nina, that telehealth is a great option. It is something that's available anywhere. You can speak with a therapist over the phone or the internet using Zoom or Discord or even FaceTime, a whole range of different modalities, which has been super useful this year as we've moved in and out of lockdown. So it's meant that therapy is able to continue regardless of whatever restrictions we're currently living with. So telehealth has definitely been useful. And also for people in regional and remote areas as well. I was telling some of the students that I'm working with in the clinic that, because I'm quite a bit older than the other two presenters, and I've worked in the outback quite a bit and have done telehealth work using even a CB radio. So it doesn't matter what mechanism we're using to connect. It's definitely beneficial and accessible, highly accessible. That said, it can also be really great to experience therapy in person as well and have that kind of visceral connection with someone else. So I would always encourage people, if possible, and if it suits you, to consider that option too. But definitely in the age of a pandemic, telehealth is a great option. So in terms of finding and choosing the right therapist for you, so firstly, in terms of finding a therapist, there's lots of different ways that you can go about that. The APS, which is the Psychologists Society, and the AASW, which is the equivalent for social workers, and also PACFA or the ACA, which are the equivalent for counsellors. They all have a list on their website of people who have qualifications that have met the standards of those associations. So you can look on there and find somebody, or you can go to an agency. There's private agency, private practices. There's also community-based agencies and government services as well. So most states have a health service. So for example, in New South Wales, there are local health districts. There's counselling available through those services for free. So there's a range of different counselling type services. There's generalist ones, there's family services, services who work with young people. And in addition to speaking specifically about young people, I would highly recommend Headspace, which is available very widely through a range of services, but they work with young people aged 12 to 26 and it's an excellent service, really strongly evidence-based. But jumping back to New South Wales Health, they have sexual assault services, family violence services, and so on. As I said, you can find private practitioners and counselling services in non-government agencies as well. I guess the downside is that sometimes there can be a waiting list or also a fee. And I won't shamelessly plug the ACAP clinic, but I will say that we are able to offer low cost and free therapy services to children, young people and adults. So from that perspective, I'm really proud of the services that we offer, but there are other services that are very highly skilled and accessible as well. And we could always help you find something if you were having trouble. In terms of working out whether the person is the right person for you, it's important that you choose somebody who has the right skill set and qualifications in the area that you're seeking assistance with. So if it is something specific, you can find a therapist who specializes in that area of practice and has done further study and understands the latest evidence-based techniques and approaches for that kind of work. But also somebody that you can relate to and get along with and have confidence in is important. There's some research that shows that relationship is the most important thing when it comes to the success of therapy, even more important than the modality that's used or even the type of qualification that the practitioner has. So it's important that you can form a really good working relationship and trust with that person. Because especially if you're in private practice, you're paying a fee for that service. So you want to make sure that it's someone that you can open up and speak with and really make some progress. Did either of you have anything that you wanted to add to that? I'm noting there is another question in the chat. So if you like, I can jump to that unless you had something you wanted to add to Nina's question.
I think that's well covered, Deb. And to add on as well with the telehealth modality, there's heaps of research to show the effectiveness of this modality. So that's something to note too.
Thanks, Jen. That's a really good point to make. So next we have a question from Edwina. So Edwina has asked, can I find out a bit more about the 8-week programs, please? And so I'm noting that our assistants have popped the clinic details into the chat for us. So Edwina, please feel free to make contact and we can give you some more information. But I'm sure that Jen and Kristen would happily tell you a little bit more now. I think we might have a couple of minutes to go. But Jen, did you want to jump in and say anything about the 8-week programs?
Yeah, so for mindfulness in regards to that particular program, we have more details on the clinic website to be able to go through those goals of mindfulness-based skills, meditation, kind of practice in a practical, applicable way, and improving coping skills for difficult emotions, distressing thoughts, feelings, and sensations. So we'll be covering those in those 8 weeks. So there'll be usually about 2 facilitators in that group as well. So it's been quite a 2-3 facilitators, I mean. So quite a good group to go through. Yeah.
Thank you. And Kristen, in relation to social anxiety, if someone's feeling socially anxious, what's it like for them to come along to the group program?
Yeah, look, a lot of members that come along do understandably feel, a fair bit of anxiety coming into it. But certainly as the group sort of moves along week to week and even throughout the session, certainly people feel a lot more comfortable and feel as though it is it's a safe and comfortable space to be able to, I guess, be vulnerable and practice some of the strategies that, are taught in the psychoeducation aspect of the group that really help to sort of facilitate that. So yeah, certainly some apprehension, but I can confidently say, as having been a facilitator now, it gets easier. And, reports from members say that, that they are grateful for, sort of biting the bullet and getting in there. And they're really grateful for having that opportunity. So, yeah.
Wonderful, thank you. So I think, yeah, biting the bullet is a really great way to think about it. If any of you out there are experiencing any kind of distress or have had experiences that you would like to talk with someone about, or even just, that shared experience of living through a pandemic and the restrictions that we have been living with, and would like to speak to somebody coming out of that, or would like to look at attending one of our group programs. There are other programs that we have as well. We've got a domestic violence support group. We've got an art therapy group for children and their experience around lockdown and COVID and remote schooling. As I mentioned earlier, we have individual counselling and psychometric testing as well, if anyone is interested in that and needs an assessment process. So there's a whole broad range of services at ACAP and many agencies. We have a really great mental health system, and it can be tricky to negotiate, but we'd be happy to help you do that if that's helpful to you. So I'd really like to thank everybody for your time in coming along to our session today. We've appreciated being with you and sharing this Mental Health Day event with you, and we look forward to speaking with you next time. So thank you so much to Kristen and Jen, and also our support team, and we'll wrap up for now, but we will see you again.